Hey, good morning and welcome to Open Mics for this Wednesday, March the 16th. I'm Dr. Stephen Stites, Chief Medical Officer here at the University of Kansas Health System. Now, we did plan to bring you our first interview with Dr. Marvia Jones, the new director of the Kansas City Health Department, but she's feeling under the weather and she's doing the right thing. She's staying home. Remember, that's what we do now in the age of COVID. So we will bring you that show at a later date. This morning, though, images are tough for those in the medical community and really everyone around the world. Hospitals in Ukraine coming under attack, leaving many without the necessary supplies to treat patients. Now the University of Kansas Health System, along with one metro group, are sending help to doctors and nurses in the Ukraine. And they also need your help to keep this going. We're going to talk about that in a moment, but first, let's get a check of this morning's medical headlines. Jess joins us from Studio B. Good morning, Jessica.
Good morning, Dr. Stites. Good to see you. Those who vape or use hookah water pipes, they may be at a greater risk than tobacco cigarette smokers for cancers of the nose, sinuses, and the throat. A study published in the journal Tobacco Use Insights says it's because vapors and hookah users are more than twice as likely to exhale smoke through their nose. By the way, more than 1 in 20 American adults vape. People who live in neighborhoods that are more walkable are much more physically active and less likely to gain weight or get type 2 diabetes or have high blood pressure. That's according to researchers at the University of Toronto. But even if the built environment is walkable, if there are many fast food restaurants nearby, no grocery stores, this is referred to as a fast food swamp, or if the streets are not safe to walk on, the health benefits, of course, can decrease or be canceled out. That kind of makes sense. All right, Dr. Stites, you'll like this. For all of you space fans out there, spending more time on the final frontier could lead to long-term changes in the brain. A new study in Frontiers in Neural Circuits suggests that spending prolonged time in space changes the white matter pathways and slows how fast the brain relays information and signals. Researchers looked at MRIs of several astronauts who spent significant time on the International Space Station. Dr. Stites, I think that's some research you might be able to get behind.
Well, it says you may have some white matter problems, but clearly we'll solve that, as did Captain Kirk in the 21st century. Yeah. We'll be ready to take that on. Just give us a few more 100 years and things will be better. But the other thing I just want to point out that, instead of people walking away from the vape information and saying to themselves, I just don't have to exhale through my nose, I'll be safe, why don't you just not vape? That could be a thought too, because if you think about what vaping really is, and we heard this from Dr. Castro recently, vaping is really like just saying, well, I'm going to spend the rest of my life walking in and out of a really heavily polluted room. Isn't that a great idea? No, actually, it's a terrible idea, and vaping is a terrible idea. Well, make sure to get your questions sent to us right now via YouTube, Facebook, the Medical News Network, and Twitter. You will find links to those right here on your screen. We'll get a check of the latest COVID numbers with Doc Hawk in just a few moments. First, let's see if there's any reporter questions today.
Dr. Stites, I do have one.
You go.
Okay, so Kara at Fox 4 has a question. They're working on a story about daylight savings time and a bill to make it permanent. Can you weigh in on the potential health implications of that?
You bet. First of all, on a personal thing, absolutely, that's a great idea. Yeah. I don't ever like letting go. I don't mind the fall back. The leap forward is always the challenge. If we could just fall back every 6 months, I'd be all good. But since that's not really how time works, at least in our century, then what we probably need to think about doing, and I think it's a really good idea, is to just move to one set time standard. Mm-hmm. And I like having more daylight overall. I think that really helps our circadian rhythms. I think it helps when people can have daylight both in the beginning and the end of the day. I think daylight savings time was originally created around the concept of making sure kids could get to school in daylight hours, et cetera. I wonder if there may be other ways to address that, Hawkeye, because I think in general, lots of data showing the less disturbance to your circadian rhythm, the better off you are. I think we all know the effect of when you've traveled west, having to come back to your house again and traveling back east. That's where you always feel like the greatest sleep disturbance.
Yeah, I mean, I would agree. I think we do understand about seasonal affective disorder and UV light and circadian rhythms, just as you've talked about. The other thing is, as we do switch seasons and change and make that transition, Daylight decreases anyways. That's kind of just what happens. But also, I think it's temperatures. It's certainly easier to be outside, walking, doing things late at night till 8 or 9 or almost 10 o'clock at night in the warm summer months. It's a little bit harder also in February to be out there at 8 or 9 or 10 at night when it's 20 degrees as well. But overall, I think that would be right, just for the reasons that you said about circadian rhythms. And again, we know about seasonal affective disorder. A lot of people on their desks at work or even at home have those UV light lamps to help with that through the winter as well. So.
I just know I usually get up about 5:30 in the morning or so to get to work or work out or whatever, and now it's 4:30 a.m. and that's just an hour lost. But if you're tired enough, you go to sleep whenever you can.
That's right.
Yeah. All right. Let's go live now to the Ukraine, where many are wondering what impact the invasion by Russia will have on the healthcare industry and what they can do to help. This is a live feed from the website webcamtaxi.com of Maidan Square, also known as Independence Square in the capital of Kiev. We know at least 9 hospitals have been heavily damaged or destroyed since the invasion began, including 1 cancer hospital and 1 for maternity. Joining this morning is Janie Ott, Vice President of Supply Chain for the Health System. Janie, welcome back. Always a delight to have you on the program.
Thank you.
And Kristin Robinson, Executive Director of Project C.U.R.E. here in Kansas City. It is a group that is sending supplies to Ukraine. Good morning to both of you. Welcome, Kristin, to our program.
Thank you, Dr.
Kristin, I
Stites.
want to start with you. On screen right now, we are showing the photos of the first shipments of medical supplies arriving in Ukraine just hours ago. This is a really big deal. I mean, that affects, I find that very affecting because if you work in healthcare and you see the photos of that hospital and the things that are happening, those look, that's tough, right? That looks like a crime to me. Tell us what was sent and the initial reaction from the folks there.
So we got a list of high priority items from the Ministry of Health in Ukraine. So what we've done is put together shipments of things like combat tourniquets, trauma field kits, wound kits, gauze, bandage, gloves, drapes, even emergency relief beds. So those were all on that first shipment that went out last week, that arrived in Ukraine this week.
Will any future supplies that could be heading are there future supplies that could be heading from Kansas City to Ukraine? We have more ready to go?
Yep. So in Kansas City, nothing has come out of our Kansas City warehouse to this point, but that will likely change in the coming weeks. I know for certain we've got one 40-foot container that will be scheduled at the beginning of April. And then we have staged 15 plus pallets of supplies that could go anytime we get notified that there is an opportunity for air cargo space out of Kansas City. So we are ready to go if that does take place.
And that's going to be tricky because it's not really clear that the air cargo, that the airspace is very safe around Ukraine right now. How do you know if it is safe? How do you get people to ship it in? Where do you land? How does that work?
So we are, at this point, we are shipping into Warsaw, Poland. And then we are working with groups on the ground, specifically with the Ukrainian military to get it to the border and across the border. And then the Ministry of Health in Ukraine then distributes it to the hospitals that are in most need. And then we also have a couple other options of other folks on the ground that we are working with to get things across the border. But so for now, we're going into Poland.
All right. We have a QR code on the screen right now if people want to know how to help or to contact you. We're going to talk more about that in a few minutes. How long has Project C.U.R.E. been helping in Ukraine?
So Project C.U.R.E., our first shipment, Project C.U.R.E. has actually been working in Ukraine for more than 10 years. Our roots there run deep. We have long relationships with hospitals and doctors there. We've actually sent 53 shipments over the last 10 years to Ukraine. So we've been there quite some time, and we've got friends and colleagues that are there, and we're just trying to do our best to get them what they need in their hospitals.
This has to be really hard for you to see those images and know that those are folks you've tried to help and relationships you've tried to build. That has to be very, very painful.
Yeah, it really is a desperate situation there, as we all know, and we see on television every day. And they're really just so desperate for the supplies and things, everyday things like women having babies, and they're still taking place in addition to, the wounds and trauma that's coming in. So it is a pretty desperate situation, and we're, doing everything we can to send them shipments as quickly as we can.
Do you have a sense? I mean, is it normal that in a time of war like this that people just target hospitals?
So it doesn't seem normal, but it does seem to be happening. And we've been told by the Ministry of Health that 31 hospitals have been bombed in Ukraine. So that just kind of gives you the scope of how big of a crisis this is. Where people are typically going to hospitals for help and care, but then their hospitals are being bombed. So that is indeed happening, yes.
Yeah, that just. I mean, I don't know. I feel the pain. I can't imagine what it would be like here if our hospital came under attack from a foreign power while we were trying to treat the people who are victims of that attack. And I struggle to understand where the humanity is in that. Some of those supplies we sent from the Metro came from right here at the University of Kansas Health System. Janie, what types of items did the health system contribute to Project C.U.R.E?
So several different things, IV start kits, scalpels, dressings, unscented baby wipes, and our biomed department even sent some retired ultrasound equipment. We've sent stethoscopes and just a variety of things from capital equipment to everyday medical supplies, guide wires and catheters and tracheostomy kits, just a lot of different things of that nature.
How does it feel to know we are helping those who may not get these medical supplies elsewhere? It's a big deal to ship ultrasound equipment. It seems retired, it still really works pretty well.
Yes, absolutely. It's amazing, Dr. Stites. It's a wonderful feeling to be able to do a little bit that means a lot in other places. And the supply chain team went to Project C.U.R.E, and we sorted supplies and packaged supplies, and we were able to be a part of helping get those supplies into countries that desperately need them. And at the end of that event, everybody on my team, they were just energized knowing that that time we spent was really going to be positively impacting so many others. And so it's a great feeling to do what we can here on site, but then also volunteer at Project C.U.R.E and impact what's going on there. So it's amazing. It truly is.
You see these images, and I'm not old enough to have been alive during World War II.
Yeah.
My father fought in World War II.
Oh.
And I can't imagine the sense of terror that those in some of the Eastern European countries are feeling right now based on the history of the region. So if you look at Poland and et cetera, it's got to be a deep-rooted sense of fear and anguish that this is coming back around again.
Right. And, we just saw images of, babies. Babies are still being born, and, maternal care is needed. And so when we were able to send unscented baby wipes, that seems like such a little thing. That's highly impactful in the environment in the Ukraine right now. So it's the littlest things that truly make a difference. And I think Kristin sees that on a daily basis.
I bet she does. Kristin, are people rallying around you and rallying around Project C.U.R.E and the work you're trying to do in Ukraine?
Yes, for sure. We've had a huge positive response from the public and everyone in the work that we're doing. So people have really come to the table and are looking to do anything that they can to help. I think people feel a little bit helpless. We're watching all of these images on television and feeling like, how can we here in the U.S., make an impact? And they can, if they, with us through volunteering, through monetary donations. Those are all things that help us do our work every day.
Yeah. Where is the humanity in attacking a hospital? All right, well, we're going to come back to more. I know we're going to have questions about this. Let me turn to our infectious disease and my good friend, Dr. Dana Hawkinson. Hawkeye?
Yeah.
How's the COVID count today?
It's getting better. 9 active infections, 0 patients in the ICU, and 0 on the ventilator. Still have a lot, 63 of that additional in that recovery period. But again, 9 active infections is great, so the total of 72.
We haven't been under 10 in a very, very long time, so 9 is a big deal.
Yep.
But Hawkeye, even as we think about that, in Europe, numbers are rising because controls and precautions have been removed, and now the BA2 variant is beginning to escalate there. What do you think?
Yeah, I think it's concerning. We did see, articles about, just like you said, Europe, UK, no restrictions. We see that cases are going up, but associated with that is hospitalizations as well, not lagging behind. So the question there is, are people actually being admitted with COVID-19 symptoms and illness, or is it because there's so much out in the community that when they come in for something like a car wreck, they're positive? But I think that just continues to go to show people and emphasize that point. Really, there are no restrictions. There's no mandates. There's really nothing overall public health guidance protecting the community. So it's really up to that individual to be up to date with those vaccinations and those booster shots. If you're immunocompromised, have that 4th dose. If you are not immunocompromised, have that 3rd dose. And there's some early publications, preprint, non-peer-reviewed out of Israel, showing that just what we had talked about. If there are recommendations for additional doses, it may be more in that group with comorbidities, specifically with age, maybe being over 65. So.
Yeah, and I saw that last night, obviously, and there's some recommendations, and Pfizer is asking for approval for their drug for a 4th vaccine shot over the age of 65. Moderna is saying, let's take a look at the data a little bit more. We're not sure if that's required yet. I thought it was interesting. One of the people that quoted gave a very wide range. Well, we're not sure if it's somewhere between 50 and 65. Yes. You think, well, dude, let's figure this out. I want to know if I'm supposed to get a 4th shot or not. But at the end of the day, I think what it means is, Hawk, we're still building the airplane, right? We think we have all this knowledge, but the reality is there's still a lot of questions, and that challenges our knowledge.
Yeah, I think we have really good bones and a cockpit to the airplane with the vaccines, because we know the vaccines, even if you read through the stories or that interview with that Pfizer CEO, he still continues to say we know that the doses that we have right now protect against hospitalization. They are focused a lot on infectivity. We know some of that early Israeli data does show an improvement in hospitalization rates, again, specifically for that older population if you've had that 4th dose. We'll see what the full data set is in the analysis, but you're exactly right. And we do know that BA2 is still, it's becoming more prominent around the world as well. So we'll just kind of see what happens.
Yeah, I think that's right. And I think our struggle is that even though we would like to have all the answers today, we don't have all the answers today, and we still have a lot of questions. And the thing we need to know is, in a population, especially a very heterogeneous population, where some people who have been vaccinated have also had the disease, some people have only been vaccinated, some people have had the disease but not been vaccinated, and some are still have neither had the disease nor been vaccinated. Who's at risk the most, especially when BA2 comes along, or the next variant? There's also these questions about Deltacron, this combination of Delta and Omicron, which it looks like the spike protein is pretty well preserved on that. So don't really think that's going to change the story very much. What do you think?
Yeah, no, I would agree exactly. Again, we know that with BA2, it can evade some of the antibodies and the neutralizing antibodies that were created with just the BA1 or the regular Omicron variant. And so I think that's important to understand. So infection, there could be still a high rate of infection even if you've had those. But really, again, what we're talking about is protection from severe disease and hospitalizations. We know that vaccination is the safest way to get immunity, and that immunity does provide good protection against hospitalization. We also know that vaccination plus infection provides that hybrid immunity as well. And so I think we are just looking to keep people safe, and we are actually looking to keep people out of the hospital and out of the ICU. And the best way to do that is to be up to date on your your vaccinations.
You know, it's interesting. We get accused sometimes. Oh, we want to bring people in the hospital, so we're telling them terrible things and not to go get help. I'm like, you've got to be kidding me. You know, we're not really built to have. Even today, we have 63 Omicron or 72 Omicron patients here in the hospital. That's not something we really want to have. I mean, you know, when we slow down the operating rooms and our folks get sick, that's when we begin to struggle. And that's true for hospitals across the country. We are all better off when we can do the things we normally do and not trying to take care of a lot of people from
you
this
know,
pandemic.
with the Ukraine and displaced peoples, and really, again, we've talked about this before, the displaced peoples from a lot of conflict areas. You know, we are majorly concerned with those people in those areas where those people are, because we know infection can spread easily, not just COVID-19, but other things as well. And so that's
well,
a
we're
major
seeing
concern.
early reports from the United Nations and others saying, look, there's going to be, and there is already emerging another big wave that's hitting Eastern Europe and Ukraine as this mass migration occurs, and as people are susceptible, they don't have access to food and shelter, they're having to come together in close circumstances, and that, you know, that again, just an example of we don't really call that being humane to each other. So I think that's a struggle for us.
Yeah, it's anything but humane, and you know, I think it's a throwback to what we saw, you know, nearly 100 years ago, and I think it's just. I don't think people understand and remember history, and I would encourage everybody to go back and watch the American History Channel or military history and watch some of those documentaries from World War II and just understand what is going on, because it's a mirror of kind of what's going on right now.
So other data also suggests now that the J&J vaccine, there's some early information saying that if you look at hospitalization rates and disease prevention rates on the J&J vaccine, you know, when you've been out from it for a while, it looks like it's similar to the mRNA vaccines.
Yeah, it's kind of crazy. We did not expect that. I think it's a happy, unexpected result, but yeah.
Yeah, so some more information to watch is that, and I think that's really encouraging, especially in countries that have less infrastructure, because the J&J vaccine doesn't have to be refrigerated. It can be a one-time, although some data suggests a booster is helpful. Yep. But even so, it's easy to give. There are a few concerns for a few more side effects, but even when we say that, we have to qualify it to remind ourselves that the actual side effect profile of the J&J vaccine, while it may not be as good as the mRNA vaccines, the struggle is the mRNA vaccines are exceptional in their side effect profile. Mm-hmm. The J&J vaccine is actually really good in its side effect profile.
Yeah, and I was actually looking at, I think there was a large Lancet Infectious Disease article published recently looking at all those adverse events, and they went through, I don't know how many million or so reports of that had been reported to the VAERS and to the VSafe. They even looked at the deaths that had been reported, and of the, I think it was, 4,000 deaths were reported around it. That doesn't mean it's associated with the vaccine. They did have autopsy reports of about 800 of those people, and more than half of those people actually died from things like coronary artery disease. Also, a good significant proportion died of COVID-19 as well. And so that's why it goes to show that you really need to be ahead of this. We know that your risk of infection and severe disease, even with vaccination, can occur, especially if you are not fully vaccinated or up to date, or you are still really in that short period of time after that first dose or even that second dose.
Yeah, I think for our listening audience, what you have to remember is that when we study these kind of questions, what we look at isn't the question, gosh, are there heart attacks and strokes and cancers after you get vaccination? Because, of course, there are heart attacks and strokes and cancers after you get vaccination, because those are all diseases, right? And they occur whether you got vaccinated or not. Mm-hmm. The question is, are there more heart attacks and strokes and cancers after people have been vaccinated? And the answer to that is no. There aren't an increased number. And that's the kind of thing we have to, and that's why people watch these databases so carefully here and around the world. Okay, a new CDC report has suggested that there are although rare, young children can be hospitalized for COVID-19, and in the Omicron era, Hawk, they may be hospitalized 5 times as much. And I remember we've heard that from our children's colleagues on this program before, that they had more hospitalizations with the worst of the Omicron wave. So what are your thoughts?
I think it's good to put these numbers into detail and put them into perspective, because number one, we've heard this fallacy since the beginning that kids aren't affected as much, and they're not affected, and that's been a good thing. But we still know they are affected. We know they can have severe disease. We know they can have multisystem inflammatory disorder. We know they can have long hauler symptom. And now we are looking at really comparing Delta with Omicron, and I think it is quite incredible, because we also heard in the same breath Omicron is less severe, and I think we have to really also understand that Omicron has been said to be less severe, but that's always in context of Delta rather than the actual Wuhan isolate, from what I understand. So, but this puts the numbers, they're pretty stark as far as percentage or how many more times you or your child can be hospitalized with Omicron compared to Delta. So it is very real, and it did affect a lot of families, over this past surge.
All right now is the first week of March. The CDC has assessed the risk of COVID spread in Wyandotte and Leavenworth counties in Kansas as still high, meaning keep your masks on, folks. But in Jackson, Clay, Platte, and Cass counties in Missouri is medium. Good news. Johnson County in Kansas is very low risk. Great news. We know Johnson County also happens to lead the area in vaccinations. I suspect those things are going together, Hawkeye. Talk to us a little bit. Is this a positive sign, though, that we're starting to see some of the improvements across our area?
Yeah, I think we continue to want that, and I think it is a positive sign. We're still looking for more, but it continues to be a step in the right direction. And again, as cases are falling, if we can continue to get vaccination rates up in this lull period before a new surge or new variant, I think that's going to be very important moving forward.
I do too, and I'd sure like to keep it at bay for a while, because it's a lot more fun.
It is much
to
nicer.
not have to worry about it as much. It's felt good to be out there in life a little bit and not having to wear a mask all the time, etc. But folks, if you live in the high-risk areas, be careful. This is when you're in high risk, the CDC is recommending keeping your mask on. Kristin, let's turn back to you for a moment. Speaking of COVID, how is COVID affecting your ability to get supplies into the Ukraine?
Well, we haven't seen too much of COVID being any issue to get supplies into Ukraine, because we are, all the shipments that we're sending at this point are via air freight. As you said, there is going to be the issue on the ground with the refugee numbers, and spread could be potentially an issue there. And so we will have, on our shipments that we're sending will be COVID relief type items like PPE and those types of things.
Yeah, that is a great thing. Again, we want to remind people that the QR code on your screen will help bring you the latest information on what Project C.U.R.E. is doing in Ukraine and ways that you can help. Kristin, what kind of supplies can people donate?
So we're really working with our hospital partners and medical manufacturers to get the supplies that we need for these shipments. But most specifically, anything trauma related, gauze, bandages, gloves, trauma field kits, those types of things, which aren't always available, and they're actually pretty scarce right now in terms of purchasing those items here in the U.S., because everyone is trying to get access to those. But really what people can do is come to our warehouse and volunteer with us. That makes a huge impact. We need volunteers to do our job and to get the supplies sorted and packed and ready to go for shipment. So that is one great thing that people can do to help. And then obviously monetary donations are a huge piece of the puzzle. They help us actually do those shipments and send them to where they need to go.
So what types of things are you hearing from your people on the ground in Ukraine? And just talk to us a little bit about that.
Yeah, as I mentioned earlier, it's a very desperate situation there. They're really just wanting anything that we can send and get to them, because they are running out. They're out of the supplies that they need to treat patients, and then also just the average soldier on the ground, or they need items as well, because there's a lot of trauma happening, obviously, with the war. So they need those trauma field kits and tourniquets and things of that nature. So we're really just doing everything we can here within our organization to raise the funds that are needed to send what they need, and working with our procurement partners to get those items into our warehouses so we can send them.
Janie, talk to us a little bit about what you think could be the struggles for the health system because of the war in Ukraine. How does that affect us?
Right. So things that we really need to be watchful is PPE. I would say that's at the top of the list, because anytime there's disruptions in our world, like the Ukraine event, PPE needs to be shipped into those high demand areas. And so then that makes PPE, something we want to keep our eye on. So currently, here at the University of Kansas, on all of our PPE items, we keep 120 days on hand. And then we proactively stay ahead of that in our purchasing patterns. And so, it's just challenging times. COVID made it challenging, and right on the heels of COVID, Ukraine. And so supply chain has been, without a doubt, challenging over the last 2 years. And we just have to be very proactive. We have to look for where impacts are and how we prepare for those impacts. And, we've been very fortunate to stay on top of that. And we will continue to stay on top of that. But purchasing right now is a challenge. And I think we even see that in our everyday life in our grocery store. So supply chain is without a doubt compromised. And so we just have to be very watchful, very proactive, and make decisions and keep those supplies coming in. Needs to be a very continuous process.
I bet that's right. So, all right, before we turn to community questions, here's my last question for you both. What's it like, and what is the best part of helping during this attack on Ukraine by Russia, about this invasion? Let's start with you, Kristin.
Sure. Well, as I said, I think everyone wants to do something. You feel sort of like, what can I do, or how can I make a difference? So it is being able to do this job that I get to do every day. It is very rewarding to be able to play a part in providing the help and working with people in our community to help us, fulfill our mission and do our job. So it is a really fulfilling and great thing to be able to do. I look at this as a privilege more than a job.
What do you think?
I so agree, Kristin. And Dr. Stites, when the supply chain team visited Project C.U.R.E. and spent a day volunteering, it's just so good to do something. I think all of us are looking for ways to support our community, to support the Ukrainians. And, by going and volunteering, sorting supplies is something we all feel very passionate about, because we are in healthcare. And so healthcare is worldwide. And so by sorting supplies and preparing shipments, it's just nice to be a small part of a bigger effort. And it really, there are just not adequate words to put around what it means to help others.
Yeah,
and
that is so true.
I think that's whether it's here or somewhere else, we want to help others.
Yes, indeed. That's why we do this.
It is. It is
here.
why we do this.
Jess, I bet you have a few questions for us to answer. Jess, don't forget the mute button.
Yes. Sorry, first day. So question for Kristin is, people asking about just toiletry items. Are those things not needed right now when we talk about putting care packages together for troops, like snack items and things that they might need when they're out there? Are those things not necessary right now, or is just sending money the best?
I would say monetary donations is probably the best way to have an impact. We really do focus on the medical supply side of things. It is a little tricky in the types of things that we send because things like liquids and rubbing alcohol or those types of things can be difficult getting through customs in some of the countries in which we work. So really monetary donations is the best, because if we don't have the items that they are requesting, like some of these trauma combat type medical supplies, we can actually go out and source those. And if we've got the funds to do so, then we can send them exactly what they're looking for.
Isaac's question is for Dr. Hawkinson. Have there been any consecutive days with no ICU patients before now? I think it's been 3 days, right?
It has
Yeah,
been 3.
I think there has
It's been a
been.
long time.
Yeah.
I don't know. I went back to the beginning of the pandemic at the end of March of 2020.
Yeah.
We've had days where census was low. We didn't have ICU patients. Like a year ago, we got down to 5 patients. I don't believe we had ICU patients then. But this is unusual, Hawk, I think, because of the sheer numbers of total patients we have to not have ICU patients. I think just demonstrating that Omicron is perhaps less likely to cause severe critical illness.
Yeah. Yeah, I would agree. And I think we went through some numbers late last week. Somebody had asked, was when we got further down, as far as really low numbers. The last numbers I have is from July 1st of 2021, we had 17 active. And that's when we were still in the teens last week when we were asked that question. But for total patients, including active infections and recovered, the last time we were in the teens was March of 2021 as well. But to answer that question, yeah, I think going back before the surges, we've had multiple days of no ICU patients. Again, that is always better. The less people we can have in the hospital and the ICU due to this unfortunate disease, the better.
Yeah, and I think the fact that we're under 10, that's a really big deal, acute patients. And that just the rest of the other things will follow. What we've got to just make sure we hold on to is that as things open up, and they need to open up, then we have to just be vigilant around the BA2 variant. And we've said that before on this program, that our challenge isn't going to be, can we eliminate the virus? The question is, how do we live with the virus? Yeah. And our answer has to be, well, we've got to change. And what we have to do is be nimble, so that when things deteriorate again, we've got to rapidly flex, so we don't get to the point where we're turning down heart attacks and strokes and can't take traumas and can't take people from rural areas, which is where we have been in the Delta and the Omicron variant. That's bad for all of us, because that injures everyone, whether you're vaccinated or not. Everyone's at risk when that happens. So the key is be nimble and also be responsible. Because if you can do those two things, then the waves will not be as bad. B, we can all get through it together. And C, we can enjoy the other end of it like we're starting to right now. Jess.
Jean is wondering what kind of treatments we are giving the recovering patients in the hospital.
Really, Hawkeye, it's back. We're at standard therapy. There's not any new therapies, or there's nothing new, brilliant, or insight around that, I don't think.
Yeah, and it's really unclear. Some of them are recovering from disease still from COVID-19, so they may still be on oxygen. They may have had complications while they were here. We know that other people that have come in with other more acute illnesses, but maybe had some COVID-19 actual disease symptoms. And also those that had tested positive when they came in, for instance, if they came in for a trauma or something else. So I think that question is hard to answer, but we do know those people that are still here and are in that recovery period, especially those that have come in with COVID-19 symptoms. A lot of times it's making sure we can get down their oxygen as much as they can so they don't have to go home with oxygen. When you come in and you have illness or you have severe illness, Dr. Stites has talked about this before, you have extreme weakness, and so we have to do rehab and build your strength back up so you can go and be at home safely. And so those are the main treatments. It's really those symptomatic and those recovery treatments so that you can get home and stay home.
Adrienne has a question. She has a client who's having trouble with a false positive COVID test at another hospital in another state. The client has dementia, doesn't understand why family can't come in. Is there any guidelines or protocols for false positives?
Well, we'd have to know a lot more about what's a false positive mean and what was the false positive and how do you know it was a false positive?
Right.
Because patients can be asymptomatic, be positive and still be able to spread the disease, especially if they're vaccinated. So I'm not sure what the meaning of false positive is, if it's a home test or a PCR.
Yeah, there are a lot of questions that we would have, just as Dr. Stites said. What is that hospital's policy on testing? What is their policy on any visitors at all? We've had some questions and had some compassionate use visitation policies when people have continued to be positive to allow visitors to come in. This was back when we had the huge surge, so we've worked with families on that to get those patients the vital interaction with that family and friends and have that visitor policy. So there's a lot of questions about that. Again, what was the mechanism of the testing? Why did they test? Are they continuing tests, which we really don't advocate for repeated tests after a positive? And then what is that hospital's visitation policy? So it's really difficult to fully answer that question without knowing some of those details. But I would encourage, maybe speak with a patient advocate or somebody. We have a couple in particular of our executives who are extreme patient advocates, and we've worked with families and friends to be able to get visitors to those people that normally wouldn't have for those compassionate situations. So I'll maybe talk with that and see if something can be done at that hospital.
Dr. Stites, a couple more questions. Mike wants to know if you can talk about reports about this debilitating tinnitus post getting the vaccine. He says that there have been some reputable physicians that have experienced this or reported this and are asking for more research. What do you know?
So heard the same thing. Again, first of all, tinnitus occurs and can be debilitating in the community. I have tinnitus long before I got vaccinated. The question isn't, do you get tinnitus? The question is, do you get it at an increased rate after vaccination? Now, when you look at the database, what has previously been reported is that the rate of tinnitus in people who were being vaccinated was not higher than the rate of tinnitus that occurs in the general community. So is it really due to the vaccination? Now, some folks have said, well, yeah, but there are some signs about that. We probably need to have our ear, nose, and throat people back down here to talk with us a little bit more about that, whether it's Dr. Sale or Dr. Ator or one of our other good folks who specialize in this kind of work. And then they can come back and talk to us specifically about those therapies. There are a lot of therapies for tinnitus. The one that I personally find the most helpful is a really low sodium diet. And you don't want to know how low sodium I mean, because you really have to get away from all the preserved foods. You have to get away from processed foods and try and cook things without salt. And if you do that, your tinnitus can get a lot better. But I would invite that we have our nose and throat folks back down here to try and answer that question more fully. Jess.
Okay, can we just go back to the vaping from the top of the show?
Sure.
I want to ask you, so are you saying that, Tiffany's curious if you're saying that somebody smoking around you has the same damaging effects as somebody vaping around you?
No. I'm trying to draw a different comparison here.
Okay.
So, there's a lot of folks who said vaping is less serious than smoking. And the reality is, actually, there are a lot of challenges, a lot of bad things that happen with vaping. And the challenge is that people want to believe that vaping is safe. And what I try to do is when I talk to my patients about that as a lung doc, what I say to them is this: look, I know you want to believe vaping's safer because people have told you that it's safer because you're not inhaling the tobacco smoke, which is burning. And because that's a different kind of smoke. The problem is that vaping has its own set of problems. And what I would invite you to compare it to is like if I walked into a polluted room or I walked into a room full of people who had vaped and all their stuff was going around, would I feel worse if I did that every day? And the answer is, of course I would. It's like going into any other form of smog or pollution or stuff that's hanging in the air. It's not the right thing to inhale. Our lungs were not meant or nor built to inhale that type of substance on an ongoing basis all the time. And it can't clear out all the different types of contaminants and the different kind of things that can injure you. So no one should be surprised when we see a rate of increasing types of cancers in people who have been vaping. Vaping is not healthy, despite what the vaping industry wants you to believe. It's like when the tobacco industry used to say, well, there's no problems from smoking, and they covered up and held on to the reports and lied about it, even though they knew it was true. The vaping industry, same thing, folks. Vaping is bad, and it is not a healthy thing, and we see the problems from that in our intensive care unit, in our clinic, and in our cancer center frequently. Don't get deluded. Don't think vaping is okay. It's not okay. Can I say that more strongly, do you think, Jess?
No, I'm asking kind of personally because somebody vaped in my house the other day out of the blue, and I just didn't know, so I had to ask that question for someone else too.
Go
and I
outside.
thought,
You want to kill yourself?
outside.
Go outside. Don't do that in my house.
Get out of here.
Yeah,
Okay.
Get out. Yep. All right. Other questions?
I think we're going to wrap it up there. I'll send it
All
back
right.
to you.
Thank you. Let's get some final thoughts from our guests. So, Kristin, first of all, thank you. Thank you. Thank you. Thank you for doing something that is making our community stronger around how we can respond to the war in Ukraine. Your final thoughts for today.
Yeah, my final thoughts would just be if people are interested in learning more about what we do, I would encourage them to go check out projectc.org on our website. And if you want to know specifically what's happening in Kansas City, you can search for our Kansas City warehouse page. And we are welcoming volunteers every day. And we are located in the Hunt Midwest Subtropolis in North Kansas City. So we just invite people to come out and visit us and kind of take a look and see what we do. And we'd love to chat about how to get involved.
Thank you, and thanks for the great work you're doing. Janie Ott,
Absolutely.
final thoughts?
Thank you for letting me share the Project C.U.R.E. story. Kristin and her team, Isabella for one, are amazing, doing great work. And I too just pick a day to volunteer, make it a community service day. If you have the tiniest of money, $5 to $5,000, whatever the number, every little bit helps. And your time, we need people's time. So, Kristin, thank you for being here, and it was great to get to share the story.
Well, we are glad you did. I'm going to return to that story in just a moment, but first, Hawkeye, your final thoughts.
Yeah, we have seen a lull in cases, hospitalizations, deaths are continuing to decrease. We know that there is no public health guidance measures, mandates, or restrictions going on out there. We've seen what has happened or is going on right now in Europe and the UK. We had a question this week about increased detection in wastewater. So we know the virus is still there in the background. And so right now I continue to implore you individually as a family or a bubble to make sure that you do everything you can individually to help protect and reduce your risk of coming to the hospital and having severe disease, and that is being up to date with your vaccinations. If you are not immunocompromised, it is that 3 doses, so it's that 2 primary series and that booster. If you are 12 and over, if you are immunocompromised, it's getting 3 primary doses, and that 4th dose is a booster. That will continue to provide you reduced risk of going to the hospital, severe disease, and death, and I think that continues to be important. As we have more information about the need for additional dosing or boosters, we will continue to let you know, but right now I think just do those things that you can individually and as a family, and if you feel uncomfortable about going to a situation, then maybe it's best not to go, and again, you are always welcome to wear a mask in those situations as well.
Sometimes it's just hard to find hope, right? When you see the war in Ukraine, you think about the pandemic, you start hearing about the rise of the BA2 variant in Europe, you think about things that have happened in Afghanistan or the humanitarian crisis that's occurring there or in regions of Africa, and you think, gosh, these are hard days. Inflation, stagflation here in the United States. I mean, these are hard days, right? These are hard times. And the answer to that is, of course, there are always hard times. It depends on where you are and where you live. So what do you have to find? I think you have to find the good times and the good moments of hope. Where do we see not man's inhumanity to man, but rather all of us trying to improve the human condition? I think Project C.U.R.E. is that hope. I think it shows us that even in the hardest and darkest of times, we can find people who are doing the good work. And it's the good work that makes us all better. It's not telling lies or fibs or making things up. It's doing good work for people who are struggling and suffering on any ground, in any place there that they are, whether it's in this hospital, the hospitals in Ukraine, or anywhere around the world. It's Project C.U.R.E., which really this Project Hope. Thank you guys for doing that, and thanks for being with us. Jess, before we go, you joined us once again from Studio B with a look at tomorrow's show and also with the ways people can learn more about our cancer program.
Yes, keep your next cup of coffee warm with some important information about the University of Kansas Cancer Center. Made in KC has produced coffee sleeves featuring the Cancer Center's logo. The sleeves also have a QR code on them that takes sippers to the center's outreach and prevention pages. The sleeves can be found in the Made in KC cafes downtown, River Market, Martini Corner, and on the plaza. Now, Dr. Stites. Let's talk about the facial hair. Deb, one of our viewers, she sent a big heart emoji, and she's like loving your facial hair. So tell people about it. Let's talk about Shave to Save, and let's put up your QR code so people can help support you.
Yeah, if you wanted to see me shave off the scruff and look and shave my head, then help support this project, this Hope Lodge. Hope Lodge is a place for families, again, a sign of hope, folks, where people can go to stay when they can't stay or they can't afford to stay otherwise, whether they themselves or their loved ones and friends are getting therapy and treatment for cancer. And so whether you've been a cancer survivor yourself, you want to support those folks, this QR code is a way to help support Hope Lodge. That's a really important thing. It's another sign of hope in this world. And you can also help me shave. And more than that, I'm going to go bald. But look at that picture right there. See how young I once was? You know what? Having Hawkeye around all the time is where I lost all my hair. I think it's that's from Hawkeye. But yeah, I'm going to get rid of this. I'm going to get rid of this. And I'm going to look super cool.
Super cool.
Yeah, I don't know about cool. Scruffy. Scruffy may be the word. Although I kind of like I like the beard. We'll see.
I would definitely let you be my guide on a fishing trip.
On a fishing trip. That's right. Well, that's awesome. Let's do it. Okay. Jess?
Oh my gosh, I'm looking at your picture right now. It just came
Don't do
through.
that. Yeah, that's.
You have so much hair. Now you have more hair on your face.
Oh gosh.
I
love
it.
you, Jess.
Thanks.
Thank you.
I know you
Thanks for that.
I just can't wait to get the video of you, like,
Shaving.
I might have to do
coming.
I'm going to volunteer to do the honors to shave your head.
No, I thought you were saying you're going to do the honor. You're going to volunteer to be Shaved to Save next year,
Oh,
and you're
okay,
going to shave your head.
okay.
Isn't that what I just heard?
Okay. I'll
No
look
answer.
into it.
I hear no answer. Okay, there you go.
Okay, yeah, nothing. Okay, everyone, thanks so much for being with us today. Don't forget you can catch our shows anytime by logging on to Facebook, YouTube, and on Twitter. Tomorrow, metastatic cancer are words that no one wants to hear, but there are now state-of-the-art treatments being offered here at the University of Kansas Health System. We're going to talk with one doctor and a patient about that and how it can help you and your family in the future. So join us tomorrow at 8 a.m. Have a great day. Alexis.
I'm Alexis Del Cid on the next All Things Heart.
I want people to know that, COVID, it doesn't have a look. It gets healthy people. It gets Black, white, Hispanic, and anyone.
2 years later, and she still has heart problems. Join us Thursday at 10.
Subscribe to our morning medical update and open mics with Dr. Stites podcast. Now, everywhere podcasts are available.